Hey Sam, tell me what brings you in today.
Well, the last time I was here, you said I can come back to talk about birth control if I wanted to. And last month we had a problem with the condom, and so I wanted to talk about using something else just to be extra safe. But I haven't used anything besides condoms before.
Okay, good. I'm glad you remember we talked about that. Tell me a little bit about what you've already heard about the different birth control methods.
Yeah. Well, I have friends who are on the pill, and they like it, but they're always worried about forgetting to take it. And I do have a friend who's using the shot, and she doesn't have to worry about taking it every day, but she does have to get herself to her appointments.
Yeah, that makes sense. The good news is that you're healthy, so all the birth control methods would be safe for you. Let's talk about some of the pluses and minuses of the different methods so that we can find the one that's best for you.
Okay.
Now, with some of the birth control methods, you continue to have a regular period, while with others, you don't get a period, or you might have some irregular bleeding. How do you feel about the idea of having a regular period or not having a period? Is that something that's important to you?
I don't understand. I've always gotten a regular period, and it feels like it wouldn't be healthy not to get one.
It's not something that affects your health, but some patients feel like it's important to them.
Yeah, I feel like if I didn't get my period, I'd be worried that I was pregnant, and it just doesn't seem healthy.
Yeah. Well, all the methods are safe, and it's not unhealthy for you to get your period less often if you're using one of these methods. But if that's something that's important to you, it's something we'd want to consider. Does that make sense?
Yeah.
Okay. Now, you'd also mentioned that some of your friends worry about forgetting to take the pill every day. Is that something that you also worry about, or is that something that's not really important to you?
Yeah, I think it would be hard for me to remember to take something every day.
Sure, it's hard for a lot of people to remember to take something every day. So what I'm hearing from you is that you'd want a method that is easy to remember and something that lets you get your period every month. Is that right?
Yeah.
Okay. A few methods that come to mind are the vaginal ring, the patch, and the copper IUD. Have you heard of any of these methods before?
No, I haven't.
Okay. So the vaginal ring is a ring that has the same types of medicine that are in the pill. Mm-hmm. You'd pick up the ring from the pharmacy and you would insert the ring yourself inside your vagina once a month. You use it for 3 weeks and then you take it out for 1 week, and that's the week that you would get your period.
Okay.
The patch is similar to that. It has the same types of medicine, but instead of inserting a ring inside your vagina, it's a patch that you would stick on your skin. You'd use one patch once a week, and then you'd have a patch-free week where you would get your period. The IUD is a little bit different from these two. It's a small device that we'd insert inside your uterus. You can use it for up to 10 years, and it's something that we can do here in the office for you.
Okay.
Any questions about these methods?
Are there medical risks to these options?
The good thing is that serious side effects are uncommon for all of these methods.
Okay. I just don't know if I like the idea of using hormones.
Well, all the hormones in birth control are safe, but just like not wanting a period, we should find a method that works best for you. The copper IUD doesn't have any hormones, so that might be a good option for you. Another option that doesn't involve hormones is continuing to use condoms.
Okay. Do both of these methods work well?
Both of the methods work, but on average, more women who use condoms become pregnant than women that use the copper IUD. The condoms work as long as you use them every time you have sex, but for some people that can be difficult to do.
Yeah. Well, I like the idea of still using condoms, but I think it makes sense to use something else too, just to be extra safe. I just don't know if I like the idea of a device in me. Mm-hmm. If I try it and I don't like it, can we take it out?
Definitely. If you don't like it or you want it out, you can come back anytime, and any of the physicians here can take it out for you.
Okay. So if I try it and I don't like it, then you'll take it out for me?
Mm-hmm. Anytime.
Okay. Can you tell me more about the IUD?
Yeah, I actually have an example here. This is a demo version.
Oh, wow. It's not that big.
Yeah, it's a small device. This is the part that would go inside your uterus, and then the strings would come through your cervix and down into the vagina. The way it works is that the copper stops the sperm from working, and so you don't get pregnant. Most common side effect from using the copper IUD can be heavier periods and sometimes crampier periods.
Okay, that doesn't sound too bad. Could we start it today?
Sure, we can do it today. We do it here in the office. So we can start it today, or if you want to think about it, you can come back anytime as well.
Oh, I think I'd like to do it today.
Okay.
Thanks.
It's important for me to structure my contraceptive counseling around what my patient prefers and what will work for her. I might know more about the different methods that are available, but my patient is the expert about what she feels comfortable with and what will work best for her in her life. I try to learn more about what Sam wanted, then suggest methods that would work for her.
I really appreciated that Dr. Adams asked me questions about my life and suggested methods that made sense based on what I told him. I was nervous about having a device in my body, but Dr. Adams reassured me that it was still under my control because I could always come back and have it removed.
Hi, Sam. I'm Dr. Jones.
Hi, Dr. Jones. Thank you so much for seeing me today. It's so good to meet you.
It's nice to meet you, too. What can I do for you today?
Well, I usually see Dr. Adams, but I wasn't able to get on his schedule, and he said I can come in anytime I wanted to have my IUD removed.
He said that?
Yeah.
So tell me a little bit about the IUD. When did you have it put in?
Well, it's been a while now. It's been about 4 or 5 months.
Okay, and what has been your experience with the IUD?
Well, it's just not working for me. I've been having some cramping, some spotting.
That is pretty normal. I mean, especially in the first couple of months. Most women say it takes a few months to adjust.
Yeah, well, it's been a while now.
Okay, well, have you tried anything to help with some of the side effects? Or would you be interested in hearing some of the options we have for managing the side effects?
I don't want to take anything. I think we should just take the IUD out. Plus, it's been giving me some headaches.
Okay, well, I know that the copper IUD doesn't usually cause headaches. That's kind of an unusual thing, so I can reassure you it's probably unrelated to the IUD, but maybe we can talk a little bit more about these headaches. Maybe tell me what they're like, how often you're getting them.
Well, the headache started after I got the IUD put in. So if we take out the IUD, then the headaches will go away.
All right, so I guess it sounds like you're not really interested in hearing some of the options to try to make the side effects better. You're just interested in getting the IUD removed.
Yeah, it just didn't work for me.
Okay, I don't see anything in your chart about headaches in the past. I might want to give your doctor a quick call, speak to Dr. Adams, just to make sure there's not something I'm missing in terms of taking good care of you. So I'm going to step out and give him a call. Is that okay?
Sure.
Okay, great.
Hi, this is Dr. Adams.
Oh, hi, this is Dr. Jones from the clinic. Hey, I know you said we could call you anytime with IUD questions. Well, your patient Sam is here. She came into the office today to have her IUD removed. And I just don't completely understand. She's only had it for 4 months, and she wants it removed because she's having headaches. But both you and I know that the copper IUD doesn't cause headaches.
Right.
So how can I convince her to keep this?
Tell me why you feel like you want to convince her to keep the IUD.
It just doesn't make any sense. It's her headaches, and I've been trying to explain to her that we can manage her headaches. You can do something about it, but she just really insists on taking this IUD out today.
Well, it sounds like she's feeling like the IUD is causing her headaches, which is what she believes. If she wants it out, I think we should honor that for her. If she realizes afterwards that the headaches were not related to the IUD and she wants another one, we can always insert one later.
But doesn't that seem like such a waste? The IUD's only been in for a few months. It's hard to get an appointment for an insertion, and they're so expensive. It just seems like she should give it more of a try.
Sounds like you're frustrated that she's only had it in for 4 months. I mean, the IUD is a great method, and it works really well for a lot of people. But for some people, it's not right. It sounds like Sam is pretty convinced that it's causing her headaches, and if that's what she thinks, it's okay, and we should be able to take it out for her today.
So I should just reschedule her with you, maybe. You know her better than I do, and perhaps you can explain things more clearly.
You know, one of the things that I told Sam and that I tell all of my patients who get an IUD is that if at any time they're not happy with it or they want it out, they can come back and any provider can take it out. She's there with you now. She's probably taken some time off of work to come see you. So if you could do it today, I think that's best for her.
Yeah, I guess you're right. She does really seem insistent she wants it out today.
And one of the other things I was thinking, you know, as family doctors, we provide a lot of our patients with pills. They go home and they may or may not take them. With an IUD, they don't really have control over it. If she's coming in today, it means she really wants it out. And I think we should honor that for her.
Well, I guess you're right, Dr. Adams. Thanks for talking it out with me. I'll go back in and explain to Sam that I'll take her IUD out today.
Okay, call me back if you have any questions, all right?
Okay, thank you.
Sure.
Thanks for taking my IUD out today.
I'm glad I could help. But before you go, do you want to talk about some other birth control options now that you're not using the IUD?
I don't really want to use hormones, so I'll just stick with the condoms for now.
Okay. Just so you know, the hormonal methods are both safe and effective to use if you ever change your mind. But for now, do you know that there's an emergency contraceptive pill that you can use, either a prescription I can give you today or something you can use over the counter, just in case you don't use a condom, or maybe the condom breaks?
I'll just be careful with the condoms from now on.
Okay, well, we're here if you ever change your mind.
Thanks again for taking my IUD out today. Dr. Adams said I can come in any time to have it removed, so I'm really glad that that was true.
I tried to stay professional in my initial encounter with Sam, even though I felt frustrated that she wasn't making logical choices. I tried to provide accurate medical information to her, but it didn't seem to change her mind at all. Dr. Adams was able to help me realize that it's important to support her in making her own decisions about her body, even if it doesn't make sense to me.
I was really relieved that Dr. Jones was able to take out my IUD today, because it just wasn't working out for me. I was worried that she would try to argue with me or try to get me to take another method, but in the end she accepted my decision.